As the world's population ages, vertebral compression fractures, or VCFs, are becoming a major concern for healthcare systems everywhere. These fractures aren't just a structural issue, they significantly impact patient health, independence, and even survival. In the United States, the annual cost of managing VCFs reaches $746 million, highlighting the immense burden on both acute and long-term care. The challenge goes beyond economics. VCFs often lead to a cascade of functional decline, stripping patients of their ability to live independently and placing a strain on families and healthcare providers. Understanding the scope of this problem is the first step toward effective management. Vertebral compression fractures are not simply breaks in the spine. They are a significant driver of morbidity and mortality, affecting quality of life and leading to serious complications. The deterioration of bone microarchitecture that causes these fractures results in a domino effect. Patients lose independence, experience pain, and often require extensive medical support. This makes VCFs a critical issue for both patients and healthcare systems, demanding evidence-based strategies for prevention and treatment. Financial burden of vertebral compression fractures is staggering. In the United States alone, the annual cost is estimated at $746 million. This includes direct medical expenses, rehabilitation, and long-term care. The economic strain is compounded by the loss of productivity and the need for ongoing support, making VCFs not only a medical issue, but also a significant challenge for healthcare policy and sustainability. Root cause of most vertebral compression fractures lies in the deterioration of bone microarchitecture. Osteoporosis leads to progressive loss of bone mineral density and structural integrity, making the vertebrae vulnerable to failure even during minor incidents. This underlying weakness is what makes VCF so common in older adults and highlights the importance of early detection and intervention. Osteoporosis is the primary driver behind vertebral compression fractures. As bone mineral density decreases and the architecture of the vertebrae weakens, even trivial events, like lifting a light object or coughing, can result in a fracture. This silent disease often goes unnoticed until a fracture occurs, underscoring the need for proactive screening and management in at-risk populations. Understanding the risk factors for vertebral compression fractures is essential for prevention. These factors are divided into modifiable and non-modifiable categories. Modifiable risks include lifestyle choices like alcohol consumption, tobacco use, low body weight, physical inactivity, and deficiencies in vitamin D and calcium. Non-modifiable risks are tied to age, sex, race, and family history. Recognizing these risks allows clinicians to tailor prevention strategies for each patient. Several risk factors for VCFs can be changed or managed. Alcohol and tobacco use, osteoporosis and frailty, estrogen deficiency, early menopause, and low body weight are all modifiable. Physical inactivity and deficiencies in vitamin D and calcium also play a role. Addressing these factors through lifestyle changes and medical interventions can significantly reduce the risk of fractures. Risk factors for vertebral compression fractures cannot be changed. Advanced age, female sex, Caucasian race, dementia, susceptibility to falling, and a history of fractures in adulthood or in a first-degree relative are all non-modifiable. While these factors cannot be altered, awareness and monitoring can help guide preventive strategies and early intervention. Most common symptom of vertebral compression fractures is the sudden onset of acute back pain. However, the real clinical challenge lies in the systemic complications that arise from untreated or poorly managed fractures. These complications can affect multiple organ systems and significantly impact patient quality of life. One of the most serious complications of vertebral compression fractures is progressive spinal deformity. This includes the development of thoracic kyphosis and lumbar lordosis, which can lead to chronic pain, reduced mobility, and further health issues. Early intervention is crucial to prevent these deformities and maintain patient function. Untreated vertebral compression fractures can lead to physiological compromise. Impaired pulmonary function is a common consequence, resulting in conditions like atelectasis and pneumonia. These complications further reduce patient quality of life and increase the risk of hospitalization and mortality. Vertebral compression fractures can also cause gastrointestinal distress. Changes in spinal alignment and chronic pain may affect digestion and lead to discomfort. Managing these symptoms is an important part of comprehensive care for patients with VCFs. The functional decline caused by vertebral compression fractures often results in loss of independence. Patients may struggle with daily activities, require assistance, and face increased risk of institutionalization. This loss of autonomy is a major concern for both patients and their families. Vertebral compression fractures can be acute or chronic. Acute fractures present with sudden pain and functional decline, while chronic fractures may lead to ongoing discomfort, deformity, and systemic complications. Differentiating between these types is important for appropriate management and treatment planning. Diagnosing vertebral compression fractures involves clinical assessment and imaging studies. Sudden back pain, loss of height, and spinal deformity are key indicators. X-rays, MRI, and CT scans help confirm the diagnosis and guide treatment decisions. Initial management of vertebral compression fractures often involves conservative measures. Pain control, physical therapy, and bracing are commonly used to support recovery. These strategies aim to restore function and prevent further complications while monitoring for signs that more aggressive intervention may be needed. Vertebroplasty is a minimally invasive procedure used to treat vertebral compression fractures. By injecting bone cement into the fractured vertebra, vertebroplasty stabilizes the bone, reduces pain, and improves mobility. This technique is especially valuable for patients who do not respond to conservative management. During vertebroplasty, bone cement is carefully injected into the fractured vertebra under imaging guidance. The cement hardens quickly, providing immediate stability and pain relief. The procedure is performed on an outpatient basis and typically results in rapid improvement in symptoms. Not all patients with vertebral compression fractures are candidates for vertebroplasty. Ideal candidates are those with persistent pain despite conservative treatment and fractures confirmed by imaging. Careful patient selection ensures the best outcomes and minimizes risks. Vertebroplasty offers several benefits for patients with vertebral compression fractures. It provides rapid pain relief, restores mobility, and reduces the risk of further spinal deformity. These advantages make vertebroplasty an important option in the management of VCFs. Like any medical procedure, vertebroplasty carries risks. Potential complications include cement leakage, infection, and nerve injury. Careful technique and patient monitoring are essential to minimize these risks and ensure safe outcomes. Research shows that vertebroplasty can significantly improve pain and function in selected patients. Evidence-based guidelines recommend vertebroplasty for those who do not respond to conservative management and have confirmed fractures. Ongoing studies continue to refine patient selection and procedural techniques. Other treatment options for vertebral compression fractures include kyphoplasty, conservative management, and surgical intervention. Each approach has its own indications, benefits, and risks. Choosing the right treatment depends on patient factors and fracture characteristics. After vertebroplasty, patients require careful monitoring and follow-up. Rehabilitation, pain management, and osteoporosis treatment are essential to ensure long-term success and prevent future fractures. Comprehensive care supports recovery and maintains patient independence. Long-term outcomes after vertebroplasty are generally positive, with sustained pain relief and improved function. However, ongoing osteoporosis management is crucial to prevent additional fractures and maintain spinal health. Regular follow-up and lifestyle modifications play a key role in long-term success. Educating patients about vertebral compression fractures, osteoporosis, and treatment options is vital. Understanding risk factors, symptoms, and preventive strategies empowers patients to take an active role in their care and make informed decisions. Managing vertebral compression fractures requires a multidisciplinary approach. Physicians, physical therapists, nurses, and social workers all play a role in comprehensive care. Collaboration ensures that patients receive the support they need for optimal recovery. Management of vertebral compression fractures has significant implications for healthcare policy and sustainability. Effective strategies can reduce costs, improve patient outcomes, and support long-term care systems. Policymakers must prioritize evidence-based approaches to address the growing burden of VCFs. Ongoing research and innovation are shaping the future of vertebral compression fracture management. Advances in imaging, procedural techniques, and osteoporosis treatment promise better outcomes for patients. Staying informed about new developments is essential for clinicians and patients alike. Summary: vertebral compression fractures are a major challenge in the context of an aging population. Osteoporosis is the primary cause, and evidence-based management, including vertebroplasty, can significantly improve patient outcomes. Recognizing risk factors, educating patients, and adopting a multidisciplinary approach are key to effective care. As research continues, new strategies will further enhance the management of VCFs, supporting both patients and healthcare system.